Welcome to DPC Pediatrician. We're Dr. Phil Boucher
and Dr. Marina Capella, two DPC pediatricians who are on a mission to share our love of direct primary care with you.
Hey everyone, welcome back to another episode of DPC Pediatricians. Today we're going to talk about behavioral health. This is something where I think a lot of pediatricians realize, okay, back in the day, being a pediatrician meant spinal taps and midnight calls to the hospital for the third kid that has an empyema and needs their chest tube reinserted, because that was what pediatrics was like in the 1950s and 60s and before. And now we're in this post-vaccine era where there's a lot of non-emergency, non-life-threatening stuff that pediatricians are called to deal with outside of like doing lumbar punctures and all of the things that our forefathers spent their nights worrying about. Like, there's a lot of behavioral health concerns. And I don't feel like, at least in my residency and from when I talk with other pediatricians, that there was a ton of emphasis on that. There was a couple. There was the Child Development Month and the Adolescent Health Time. But by and large, like, a lot of the parenting strategies and a lot of the things that parents bring up on a regular basis of, here are the concerns that I'm having, or how do I deal with this toddler issue or this school-aged issue? A lot of it is really behavioral health related or mental health related. And it's not necessarily which antibiotic should I use or what blood test do I need to order for Wilson's disease or those sorts of things that are filling our days. And so in DPC, I think we get the opportunity and privilege to spend more time talking with families because we have longer visits, because we have less of a rush to get patients in and out, and we can deep dive into those issues and explore those issues without just referring them or telling them to read a book or a podcast. So a lot of DPC pediatricians in particular want to be able to provide some behavioral health resources and be a resource for their families. And Marina, you have integrated this into your practice in several different ways. Can you walk through kind of like what you've done or how you help families when they have the typical behavioral health issues, when they have more significant things that either need ongoing therapy? You do hypnosis, which is so cool. Or if they need medications. Can you just kind of lay the groundwork for what you do in your practice when it comes to behavioral health issues?
Sure. I'll just start out kind of referring to my past life and what motivated me to do more behavioral health. In the fee-for-service practice where I worked, it was actually a community health center in California. I was often frustrated by just these really rushed visits that, of course, everyone in pediatrics nowadays has, and seeing lots of teens with depression, with anxiety, sometimes with eating disorders or some other things, behavioral health challenges of all kinds, right? And it was so frustrating to just feel helpless to really help them because I didn't have the time to do any sorts of therapeutic interventions myself, not because I wasn't capable, right? We're physicians, we're capable of so much, but because of the time. And so my options were to refer them out to a therapist, right? Or psychiatrist. And those waiting lists are ridiculously long in most communities, right? So you're going to be lucky if they ever even call the number that you tell them to call, right? Because it's another barrier. And then you're going to be lucky if they even get seen within a few months, right? I have even very well-off families that try to get in to see a pediatric psychiatrist, and it's 4 to 6 months out, right? Because there's a shortage of mental health providers, especially for pediatrics, but in general as well. So I always wanted to be able to do more, and I knew that I could do more if I had the time. So in pediatric DPC, all of a sudden I have the time. Now, it's not always easy because as I get busier, it's not unlimited time either, but still 30 to 60 minutes is way better than 10 to 15 minutes that I had in my past life, right? So I started to pursue trainings and education and things that would help me to enhance my ability to offer therapeutic supports. Like, what can I do in my office? So in early 2022, 2 years ago, I started taking courses through the American Society of Clinical Hypnosis. And I just got hooked right away. I was like, wow, this is really powerful. It's essentially, people get scared by the term hypnosis because they associate it with mind control. But it is not mind control.
Like the clock that somebody is holding up, and then the chicken, like the person running around like a chicken. Like, that's just what cartoons have led us to believe what hypnosis is.
Exactly. That's stage hypnosis, right? But really, I think all hypnosis is self-hypnosis. It's teaching people tools, including things like visualizations, guided imagery, meditation, and mindfulness. There's a lot of overlap between hypnosis and those modalities. Teaching them how to practice those things to improve their state of well-being, right? And so in kids, it's a lot of utilizing their imagination. So
Right.
I teach them this visualization called the happy place visualization, and another one called the bubblegum visualization, and another one called the balloon release and the control panel. And this is all hypnosis, but it's empowering these kids, and it's helping them to realize that they have more control over their thoughts and their feelings than they've ever realized. And
Right.
it's so amazing. Just yesterday, I saw a kid who who has underlying anxiety, but was also in a car accident and had had sort of some behavior like anxiety fallout from that accident. And he's been practicing diligently every day before he goes to bed, his happy place and his balloon releases. And he told me that he also happens to have ADHD. So he was having some trouble sleeping, not just because of the car accident, but because in kids with ADHD, it's really hard to turn off that brain in
Sure.
order to go to sleep, right?
Right.
And so he told me that every night before he goes to bed, he does the balloon release and he lets go of all the fear and the sadness and the stuff from the day. And he's able to fall asleep right away. And this is like a 7-year-old boy.
Oh my gosh, that's amazing. Yeah.
Yeah.
I will say, as an aside, I got to witness this when we were at the Pediatric Mastermind conference, and it was just eye-opening to me. First and foremost, what hypnosis was versus what it wasn't. But just sitting there, I wasn't up on stage with you, like
Yeah.
being the not the contestant,
The subject.
the subject. Thank you.
The volunteer. Yeah.
Like, come up on stage. You're the next one on The Price is Right. But it was, I mean, I could just see how helpful it'd be because we would kind of close our eyes and visualize the things that you're talking about with the subject. And you could just see how beneficial that would be for a child that's able, much more than I am, to involve their imagination and visualization and to just be able to experience that. And so, I mean, I think that's super cool. And I actually signed up for the hypnosis training in October based like during that. I was supposed to be focused. I was supposed to have my eyes closed, thinking about balloons and control panel and happy place. But I was on the website, like reserving a spot for the conference this fall.
That's awesome. Yeah. So yeah, that conference is through the National Pediatric Hypnosis Training Institute. So I took a couple of courses through ASH, and then I found out about the Pediatric Hypnosis Training Institute, and I signed up for their conference, which happens every October in Minnesota. I encourage anyone who has any interest in this or in helping kids with behavioral health problems to look into it because it really is fantastic. And you can do so much. It doesn't even take that much time. A lot of these kids that I see after car accidents, I see them for like 6 weeks, and it's really just like a 20-minute visit each time. I'm also combining it with some other integrative modalities, hands-on therapeutic technique called Miofacial release therapy, which helps to kind of let go of the tension, the physical tension in the body. But the kids are doing these visualizations and self-hypnosis techniques at the same time, often, depending on the age and depending on their unique situation and personality, of course. But it's really cool to be able to do that. I also sometimes just, not everyone is willing to do hypnosis or willing to do visualization. So I obviously do the stuff that a general pediatrician does, like ADHD medication management, basic medication management for depression and anxiety. But I also try to incorporate these techniques as much as I can if the child or the teen is open to them. And I do utilize a couple of cognitive behavioral therapy techniques as well, and just talk therapy in general. So because of the time and the flexibility of DPC, I've been able to do that with my patients that need it.
I think that's the biggest thing is like you said, the wait lists are so long. The cost is so high for families. And the time in a fee-for-service practice, you just don't have time because you have to see 4 or 5 patients per hour. You just can't get into the weeds of working through those sorts of things or providing anything more than a referral or listen to this book or read this book, listen to this podcast.
And
check this resource out. I just don't have the time because I got 3 other patients waiting to sit down
yeah,
and talk with you or do something more involved like hypnosis or even
yeah,
like just kind of, strategizing together, coming up with some scenarios and responses and those sorts of things.
yeah. I will add you have to be careful with how you price these services because it's easy to just kind of calculate your numbers for general memberships. And
Hmm.
then if someone has more intense needs where they need a weekly visit, that's not going to be covered under your
Right.
general membership plan. So I kind of learned this the hard way in the beginning. I was trying to do too much, and then I had to create sort of a separate behavioral health membership for kids who really do need more intensive therapy or work, just in order to not lose money. Right.
And patients love it, and they sign up for it because they see the
Yeah.
value of it. Yeah, so
Hmm.
it's valuing your time too, and not just
Yeah.
thinking, "Well, because I can do this, I should do this for everybody." Well, everybody doesn't need that all the time, and they might have spells in their life where they need that, and then they
Yeah.
have spells in their life where they don't need that, so we can, price things differently depending on their needs.
Yeah, tell me about your practice. I know that you have a therapist that works within your
Right.
practice. I know that you have your own version of a behavioral health plan. Tell me a little bit about how that evolved and how it's working.
So, we do a couple of different things when it comes to behavioral health and mental health in our practice. First and foremost, I mean, we provide the mental health medication management, anxiety, depression, ADHD, autism medication management when called for our members. And we don't really carve them out if we're simply doing medication management. We usually do every couple months visits for ADHD, depression, anxiety, whatever it might be, at the appropriate intervals. And then a lot of it is over text message or email, like how are things going? Are we on the right dose of this medicine? What are we seeing in school and at home? And things along those lines that general pediatrics wise. We do have a specific mental health plan in our practice. And this is specifically for families that want higher touch for their child's mental health needs. It's usually anxiety or ADHD are the two main
Okay.
ones where we're helping, where we're managing specifically their medications for their mental health issues, but they're seeing their regular doctor for their sore throats and their physicals and their broken bones and those sorts of things. And so we
Hmm.
created that because there was such a need in the community for
Yeah.
people that wanted a little more high touch when it comes to their child's ADHD, or they want to try some things before they jump on medication and felt like their doctor just was like, oh, they have ADHD. Well, here's their medicine. See
Yeah.
you later. And they wanted more than they were being offered, but they didn't want to break
Hmm.
up with their pediatrician just yet because they like all the other aspects of it. And they know that's something
Yeah.
that we have the time and interest and passion for is, well, what can we optimize before we start medications, and what can we do in conjunction with if we're doing medication to make sure we're actually making progress and not just medicating them and not
Yeah.
addressing all of their executive functioning skills and lack thereof. And
Hmm.
so we do that. So a regular membership for a school aged child is $85 per month for
Hmm.
our practice. If they're doing mental health only, it's $75 per month. So it's just a little bit more cost effective for families. And actually, it's really cost effective for us to do mental health versus making them join as a full member because we know the typical requirements of a child with ADHD in terms of visits. And then we don't
Hmm.
have to address squeezing them in because they have a sore throat or a broken bone or anticipating their other needs. So actually, from
Yeah.
a cost and return on investment of our time, it makes sense to do
Yeah.
a slightly reduced cost membership that's just the mental health carve out. And families love it too. And it's been a really nice way for us to help more families in the community that aren't ready to join fully, or they have one child that really has this need, but their other children are generally healthy and they don't see the value at this point of DPC. They're able to make use of that. We also do evaluations for those. So for ADHD, we'll do a one-time evaluation. We can give them their information. They can decide if they want to become members and continue to access our resources, or if they just wanted that evaluation done and then they're going to go see their regular doctor or someone else for the management of their child's ADHD.
Yeah. Speaking of ADHD, that reminds me, I also do autism evaluations, and you
Yeah.
do as well, right? So
Yep.
that's another behavioral health offering that you have the option to do if you'd like in pediatric DPC. Not everybody wants to do that
Right.
because it can be quite involved and requires extra training and supplies and things like that. But that was another need that I saw in my community in California as well as here in Utah. And
Totally.
it was so frustrating seeing these poor families that are on waiting lists for 1 to 2 years sometimes.
Oh yeah, for
And
sure.
it's
Easily.
crazy. Yeah.
Well, when you
And
think about
so,
like, okay, my 2-year-old needs an autism evaluation, they're not going to get autism evaluation until they're 3.5. That's like 40+% of their developmental time to date waiting to get that
mhm,
evaluation done. And like you have told me, I mean, you inspired me to get trained to do autism evaluations, and it's one of
uh-huh,
my absolute favorite things to do. Getting to
yeah,
sit on the floor and do an ADOS with a 2-year-old
uh-huh,
or a 4-year-old, like
yeah,
there aren't that many things that I enjoy. I mean, maybe doing
uh-huh,
stitches I enjoy
yeah,
as much, but otherwise that's
uh-huh.
one of my favorite things to do is those autism evaluations.
Yeah, I would agree. I love doing them. It was a little uncomfortable in the beginning because it wasn't something I had done before, and the way that you have to score the the
Yeah,
ADOS 2 is a little tricky in the beginning, the first few times, and you have to use a separate module for
right.
toddlers versus slightly older kids versus teenagers, and so it's a little bit of a learning curve, but I love doing it. I use it together with something called the Autism Diagnostic Interview, which I think is
Mhm.
especially important for older kids.
Oh,
With
for sure.
younger kids, you can often tell right away from the ADOS too, like whether they meet criteria or not. But sometimes I evaluate older kids or teenagers who have more subtle signs of autism. And
For
so it
sure.
really takes kind of some digging into that history to really ascertain whether or not they meet diagnostic criteria,
But
especially
again,
teenage.
you have the time. Like you
Yeah.
get to do this because you have the time because there's no
Hmm.
way that you could do this in a fee for service practice where you have a 60, 90-minute ADOS and then the scoring of that and then the ADI and all those different
Yeah.
aspects that go into it. In a regular fee for service practice, your employer is going to say, I think I'd rather have you just see 15 patients
Yeah.
rather than do an autism evaluation. So we're not going
Uh
to
huh.
let you do that, even though it's something that
Exactly.
you're passionate about and that you could do and it would be a huge win for our community. No,
Yeah.
why don't you just create a bunch more RVUs instead?
Exactly, exactly. Yeah.
Yeah.
So, yeah, and I don't do a ton. I do 2 to 3 a month,
Mhm.
and I get to charge. I initially I was only charging 800 and I quickly realized that that's way too little for the amount of time that it takes. So
Yeah.
now I charge about 1500 for the evaluation and I've gotten more efficient and it's faster the more that I do, but it's really nice and families are so appreciative. Some families can't afford to pay that 1500 upfront, so I say, look, make a down payment of as much as you
Right.
can, and then just schedule monthly payments. And I feel good about it. I get the money eventually. I'm like,
Totally.
it's
That's
great to
exactly
be
what
able
we
to
do
do that.
too. We don't
Yeah,
charge quite as much yet because it's still kind of a newer thing for us in the community. We do
yeah,
900, but we'll do payment plans too
yeah.
because parents are just grateful. And usually, if they have to go and see a psychologist 18 months in the future, it's going to cost them a lot more, anyways. I mean, it's usually
Oh yeah,
$1,500 to $5,000 plus for an
yeah,
autism evaluation
mhm,
when you're private pay. And so
yeah.
it makes financial sense for them too, especially if you can offer them a payment plan. Like they're going to be
Absolutely.
happy to save all of that time and
Yeah.
save money too.
Yeah, and I do for that specific service because it's a big chunk of money. I offer super bills. And so I say, I don't guarantee that you will get any of your money back, but here's a super bill with the
Yeah,
diagnostic codes and the CPT codes and whatever. And some families have been successful in at least getting partial reimbursement for that.
absolutely. Yep. I
Yeah.
think that's worth mentioning too, because some families
Hmm.
just want to make sure that they can at least submit it to insurance to get
Hmm.
reimbursement for. The other thing that I didn't really touch on, we have a therapist in our office too.
Yeah.
She's a play therapist. And so she works with kids. This isn't something that I knew a lot about before getting into DPC, like the different types of therapy. Play therapy
Hmm.
is great for like ages 3 or 4 to 9 or 10 because it's more like you're sitting, you're playing games, you're coloring, you're doing art, and then you're talking through those things in a very child directed way rather than sitting on a couch and spilling your
Yeah.
guts to somebody that's kind of,
Ever.
keeps asking you questions. And so she does play therapy for little kids and then she does regular cognitive behavioral therapy and some different
Yeah.
modalities for bigger kids too. She has her own LLC and she is in our space. And
Hmm.
so some of our members will see her and a lot of patients aren't members that see her and then they're just kind of in our space, which helps with
Yeah.
foot traffic, honestly, and
Yeah.
they kind of get to know the way that we practice as well. And so that's been really successful for getting patients access to a therapist in a much more streamlined, efficient manner. And so
Yeah.
we love having her as a part of our team. I mean, she's in her own LLC, but we consider her part of our team. And it's nice to be able to bounce ideas off of her. It's nice to have that co-located, and then to have
Yeah.
the families that see me and then they see her for their mental health needs. And it's been a really cool way to serve the community, especially with mental health issues. And she's gone from zero. She was at zero. She didn't come with any patients, and she's more than full now in under 2 years. And so it's a very viable option for practices as a way to bring in additional revenue, increase their ability to serve patients, bring in more foot traffic. Like, it's been a win in every capacity for our practice.
Yeah, that's fantastic. I would love to eventually have, a bigger space where I can do that. So that's my goal in the next kind of 3 to 5 years, to have more people within my space, kind of create that medical home that, other practices try to
Right.
create, but in a direct care sort of setting, with lactation support, with
Mhm.
behavioral health support, with maybe some PTOT, support. So that's kind of my big dream, but not
I love it.
everybody has
That
to
is a
do
great
that,
dream.
but it's a possibility, right? I will also add that we know some pediatricians who have decided to do direct care, and they don't really like doing all the general pediatric stuff. So they've opted to just focus on behavioral health. And you
Right.
can do that within
Totally.
direct care, because nobody's dictating what you have to do in an insurance-based system. So I know someone here in Utah who does that, and she only works like 2 days a week because she has a lot of kids and her family is a priority. But she
Mhm.
does pediatric hypnosis like I do, and she does other sorts of therapy as well. And she just focuses on behavioral health, and she loves it. I think I know another pediatrician as well who was at the mastermind last year and talked about treating anxiety, and she also focuses on behavioral health. So that's a possibility as well if your passion is treating kids with behavioral health and mental health conditions.
Totally. Yep. I think that's the thing that runs through all of these threads of all the episodes that
Yeah.
we've done is you have the time, you have the control, and you can do a lot more than you've been told by the hospital clinic administrator. And
Yeah.
each practice, you as the owner and as the operator get to pick what you like to do and focus it on that. And it's so rewarding to be able to say, I want to see more of this type of patient, and not have it be this. I mean, I think a lot of people in the fee for service world, they get their, and their child is in for their annual checkup, and they look at the PHQ-9 and they're like, oh shit, this is going to
Yeah.
throw a huge wrench in my day, because I wasn't expecting this child to have this many issues, and we
Yeah.
only have 12 minutes to do their entire sports physical and talk through this, or they're
Yeah.
full of anxiety, like, how are we going to make this work? Whereas I'm
Mhm.
like, I would love to see more patients with anxiety, because we have the time to really talk with them and come up with strategies to help them and to work through those things, and then get them the extra support when they need it, but
Yeah.
feel really comfortable with, here's where I think you should start, here's what I think you should start with, and then let me text you in 2 weeks and see how we're
Yeah.
doing and how things are going. Like, that is just,
Mhm.
it's been such a dream to be able to offer that to families.
Absolutely. Yeah. So, to all our listeners, what are you waiting for? Come join us on the bright side.
Amen.
All right. Well, thanks for listening, and until next time.